Safer sex.
Intercourse. Condom.
Sexually transmitted infection. HIV.
STI
HIV. Sexual health. Research. Treatment.
Prevention.
Sexual attraction.
Sex
Sexually
education.
transmitted infection.
Contraceptive.
Sexual health specialist.
Hello and welcome to the podcast. I'm Tom and this is the Sydney Sexual Health Centre podcast where we discuss all things related to sexual health. Today we are doing another professional profile. My guest today is Professor Basil Donovan. Basil has worked as a clinician and researcher in sexual health since the late 70s. He is currently a National Health and Medical Research Council Practitioner Fellow and a registered sexual health and public health physician. He heads the Sexual Health Program at the Kirby Institute and is the past president of the International Society for STD Research. He has recently retired as a senior staff specialist here at Sydney Sexual Health Centre, where he's been involved in various capacities since it was called the Sydney STD Clinic back in 1979. So welcome to the podcast, Basil.
Thanks, Tom.
Let's start at the beginning. Did you grow up here in Sydney?
No, I'm a bush boy from down in the Riverina. I was born on the Murray River and educated on the Murray River and came up to Sydney on my own at age 17 to go to medical school.
And was sexual health something you were always interested in?
No, I had no interest. I sort of scraped through my medical degree. I wasn't particularly impressed with medicine. I didn't really like it, to be honest. I had a horrible intern year at Blacktown District Hospital in 1977, where essentially I was working 140 hours a week, manning one of the busiest emergency departments in Australia on my own as an intern. So by the end of that year, I decided I didn't want to be a doctor anymore. It was pretty grim. To this day, I'll never know how many people I killed, but that was just the world in those days. I don't want to get too political, but we had a premier called Bob Askin who essentially decided that no Labor voting part of his state would have access to adequate health services, and he succeeded in that.
That's pretty grim. So what turned that around?
Then I did what I'm forever grateful that I did. I took a gap year and I headed off to Europe for 12 months to follow the motorcycle races. And had a wonderful time, got to see lots of Europe and North Africa for a year, and then Japan and India. Then I came back and I realised, I suppose I should do some work now. So I was doing various locums while I was studying naturopathy, because it was the 1970s. And the one thing that doing naturopathy taught me is that naturopathy is absolute crap. It's all made up by people with chips on their shoulders who really don't know what they're doing. But anyway, in the various locums, I stumbled into the old Sydney STD clinic. And it just struck me. It was just such an interesting place. It was completely different to the type of medicine I'd done before. A lot of the colleagues were really, really lovely people, and I particularly liked the patients.
And I suppose back then it was referred to as venerology, I guess, the field. And
it wasn't called anything in those days. In those days there was no specialty in Australia. Jobs like doing locums at the STD clinic were the sort of thing you did to fill in time before you went on to become a proper doctor. So there was no career structure, there was no training. You just pulled up your sleeves and started seeing the customers. And there wasn't even really a manual. It's the main educators in the clinic were the nurses. The nurses told the doctors what to do because the nurses tended to stick around longer than the doctors. But by lunchtime on the first day, I decided this is for me. They were all good fun. Every patients were teaching me more than I was teaching them. So I learned a whole lot about cultures that were not visible down in the Riverina. I met people like sex workers and gay men and all these people with various labels that, if you like, quite often the labels dehumanise people, and I was quite surprised to find they were just as human as anybody else, and that just transformed me. And I thought, there's a lot to learn here.
You started working in the area in the late 70s. Soon after that, I guess there was the first AIDS patient diagnosed at St Vincent's Hospital in October 1982.
Not quite.
Oh, is it?
That's the party line. I lasted a couple of years on and off at the Sydney STD clinic, but the clinic was revolting in those days. It was literally a toilet.
Okay.
It had open urinals running between the consulting rooms.
Okay.
And we campaigned to improve the services, but the government wasn't going to do anything to improve it. So 4 of the doctors at the old Sydney STD clinic and the senior nurse all picked up their suitcases one day, and we headed off and opened our own private practice in Darlinghurst, which is now the Taylor Square Private Clinic. They say the first case was diagnosed at St Vincent's in 1982. No, there were many people who had illnesses that was pretty obvious they had AIDS, dating back to 1981, and were being managed by people like us and various GPs around Darlinghurst, King's Cross, Surrey Hills. There was just a particular event where someone got formally diagnosed, and they were probably diagnosed by their general practitioner, a guy called Harry Mitchell-Moore in King's Cross, but then they were then referred to St Vincent's. But of course, St Vincent's took the claim. That's life. But yeah, we had hundreds of patients that we suspected were affected by whatever it was that caused AIDS in those days. Because I was there from before the beginning. Even that's not true. I remember I had one patient in 1982 who clearly had AIDS. He had a recurrence of his lymphoma, and in retrospect, he'd been infected at least since 1976. So it had been around a lot longer than we suspected. And in retrospect, we now know that it was being imported from Africa into Belgium in the 1950s. It just became obvious when the numbers became large enough. But yeah, he was a bit unlucky. He was an Australian diplomat with a Haitian boyfriend. And so he was one of the earliest affected. I've met many very impressive people, particularly as patients, and it's sort of sad to watch them as young teenagers deciding that they're coming out and trying to warn them about the dangers and what they should be doing, and watching them not really listening to you because they're enjoying their new lifestyle. That's human nature. A lot of people, once they got HIV, they just grew with it. It made them bigger people. But it was pretty grim up until about 1996, 97, when people stopped dying.
And what was the general response from clinicians and politicians at the time?
Clinicians varied. Some clinicians said, right, we better tackle this, or I'm here in this job and that's what the cases they're going to present here, so I better learn what I can. A lot of people in the STD or venereology field just left. They thought, oh, that's a bit scary, that's too hard for me. Yeah. And they went away, thank goodness.
Okay. But you weren't tempted? Or?
No, we basically, even the earliest efforts were research driven, because you've got to remember they hadn't found a virus. They didn't even know if it was an infectious disease at that stage. So our first thing to do was start a big research cohort with, the only thing we knew was that it disproportionately affected gay men and drug injectors and Haitians. And we didn't have a lot of Haitians, so we recruited 1,000 gay men and just set them up, got them to join our study. They filled in questionnaires regularly. We collected blood off them, nothing much to test them for, though we were measuring their T cells or their immune system at the time. And basically that research cohort taught us all we needed to know about HIV.
I suppose something which is kind of topical at the moment is, they just released the It's a Sin TV show. Do you think that those sort of representations in media are kind of accurate of time?
Yeah, it's been a bit of a struggle for me to watch It's a Sin. It's too accurate. It's very good at portraying the sort of emotions, and it takes you through those very early days where people were terrified, perhaps behaving irrationally. The health system was often very hostile. And it took us a few years to work out what was actually causing it in the first place. But yeah, I struggled to watch that because the stories were too true. I don't think there were no exaggerations. That was all real.
And so, how did you and the other people working in the HIV response stay resilient during that time?
I think just pooling your experience, teaching each other, doing research, trying to work out what was going on, because if you really want to make someone frightened, make sure they don't know what's going on. So to reduce the fear, the idea was to chase knowledge or create knowledge. And I think that, because I remember in those days, they talk about conspiracy theories, visiting friends up the North Coast, all old hippies who, by 1983, they were absolutely convinced that AIDS was caused by an experiment conducted by the CIA that had gone wrong. And I'm going, hey, there's nothing new in this world, is there? And I had to explain to them that the CIA isn't that smart. It wouldn't know how to create HIV. Conspiracy theories are the result of people feeling powerless, and essentially they're pretty ignorant. And they stay ignorant because as soon as they adopt the theory, they go out of their way not to actually learn anything about what's going on. Yeah, probably one of the most impressive characters was a medical student who was sitting in with me called Brett Tyndall. Okay. Brett was originally a speech therapist, but he enrolled in medicine at Newcastle University, and he wanted to learn a bit about HIV, so he was sitting in with me at the Taylor Square Clinic back in the 80s, and we went for a drink after work. Kinsella's was the bar, I believe, yeah. And he proceeded to get very sick in front of me. And he was basically the world's first fully documented case of what we call the primary HIV illness. He got incredibly ill, put him into hospital that night in the space of a couple of days, because we'd been measuring it before he got infected. In the space of a couple of days, his immune system had collapsed. And anyway, Brett soldiered through. He donated litres and litres of blood because we needed to know what was going on in his blood, and he was happy to donate it. He dropped out of medical training and went on to do a PhD on the primary HIV illness and became a world authority on it. And he was the first research officer at the what's now called the Kirby Institute, which was then called the National Centre in HIV. And he was a real leader. He taught me a lot about the political dynamics in the gay scene. I think he taught David Cooper, my late boss, a lot about this is how you handle. You have to, every infectious disease or every disease has to be handled within a society, and that's what he was good at doing. This is how you go about it. If you don't work with the society, you don't get anywhere. There is no magic bullet. So he was a spectacular character. We lost him years ago.
And so I guess talking about the Kirby Institute and your work there, you worked in sexual health more broadly than HIV. So what are some of the achievements you're most proud of for your work and research?
Probably my proudest thing is listening to my customers. Yeah, once you learn that they aren't as stupid as some doctors like to think they are, if you actually listen, they'll tell you what's going on. That's how we managed to discover the primary HIV illness. That had been around for years. It was well known in the gay scene as the Hawaii syndrome, because people would go for their annual holidays to California or New York, and in those days planes couldn't get right across the Pacific. They had to stop in Hawaii. Okay. And the ones that were too sick to proceed would get put off the plane in Hawaii on the way back.
Did they have some sort of facility there, like to care for them, or was it?
No, they just had a general hospital, but okay. They were too sick to fly onto Sydney, and the illness would last a couple of weeks, and they'd be in the hospital there, and then they'd get on the plane and finally get back to Sydney. Remember, this is before blood tests. So I guess when us discovering the primary HIV illness was basically our customers were telling us what to watch for. Mm-hmm. So they described the illness long before the doctors did.
Yeah. So there's already that community awareness out there.
Yeah, and the same with the other communities. The sex workers, the organised sex workers were able to work out what was likely to work. The great Dame Julie Bates, as we call her, she has a bit of a business head, and she managed to negotiate with influential brothel owners that safe sex was the way to go. So we were amongst the first countries to have a safe sex industry.
Well, I suppose condoms at the time as a risk reduction strategy was a very novel thing as well. I guess it was mainly used for pregnancy, and so the idea that gay men would use that.
Condoms were very badly received when they first came, when they were first mooted. I had one patient who loved the idea because he was a rubber fetishist, but only one patient. Everybody else hated them. A lot of that was overlaid with the fact that in those days, if you were young and gay, you were still very reluctant to admit that to yourself. So a lot of these guys would have sex with one or two women just to see if they could cure themselves. And because of the contraception issue, they would use condoms. And shall we say, they didn't like the sex. And in the process, they really didn't like condoms and what they connoted. The link. So to them, that was condoms were an anti-pregnancy measure and symbolised an event in their lives that they would rather forget. So there was a serious reluctance to use condoms early on.
Mm-hmm. And how was getting that message out there? I mean, it must have been difficult.
It was very difficult. That was driven by the precursors of ACON, the couple of clever Australian gay community people. They were actually much better at it than the Americans. The Americans, all the HIV messages or the AIDS messages were very sex negative. Don't do this, don't do that. They even banned oral sex in the States. And at least the gay men here had the wherewithal to go, well, if someone told me that, would I listen to them? They thought that through and they went, no, I wouldn't ask anyone to do anything I wouldn't do myself. So the messages were much more realistic than in the American scene, where America, they were just absolutists. They were silly in some instances, which is why the messages failed. They were much more often than in Australia. A couple of my most interesting papers I wrote were actually given to me by a taxi driver.
Okay. Oh, why's that?
Oh, I was going to Sydney Airport, and he said, well, where are you going? And I said, to Bangkok. And he went, oh, I love Bangkok. And then he launched into his taste for the bar girls, and so and I'm going, don't you worry about AIDS. And he's, oh, no, I do this. And he strung off a list of the mostly ineffectual strategies that he used to avoid catching AIDS, as he called it. And I thought, oh, that's an interesting thing to do some research into.
And what sort of strategies were people using?
Well, when I, not just him, but a whole lot of other people, when I pooled all the different strategies, there's 57 different things people do to avoid infections. And that might begin with don't dare go out, just stay at home and get drunk. And I've known people who've used that as an active safe sex strategy. Be careful where you go to. Be selective about who you have sex with. The paradox is the criteria that one person uses to select a partner might be completely the opposite to what another criterion someone uses. It's all, most of the strategies are notoriously unreliable, but we need to recognise that that's what people put their faith in.
I suppose it's not that different to the way a lot of people approach reducing risk around sexual practices now.
No. None of the practices have gone away. And some of them are institutional, like the military used to have a deliberate policy, written down policy, to make sure that by the time the troops went to bed at night, they were absolutely exhausted. That way they wouldn't have any interest in each other. They were so scared of the troops getting too intimate with each other. And some boarding schools have the same policies. Make sure they go to bed exhausted. These are some of the strategies are just absolutely hilarious. That's why I love this field. It's really it's like people were made to entertain you. the old clinic's changed a lot. Do you know much about the history of the clinic?
No.
It used to be down at Circular Quay. There by international treaty.
Okay. Why's that?
The Brussels Agreement of 1924 says that every major port in the world should have a VD clinic for the sailors. So it was actually set up primarily to service international sailors. So by modern logic, you'd probably put the clinic at Sydney Airport, I suppose. Of course, and so all the great clinics of the world were always right and the oldest ones are all in the ports. So Rotterdam and Liverpool in England, and so they historically in the most interesting part of town. Same with Amsterdam. Probably it wasn't until World War I that there was any interest at all in the STIs. That was only because it laid up armies. When you're losing a quarter of your troops because they can't piss, you're starting to go, oh, hang on, this is serious.
I suppose some of the early treatments and like mercury and that sort of thing, like.
There were worse treatments than that.
Okay. What sort of things?
Well, if there was a back in the 18th century, if there was a medical specialty that looked after STIs, it was the surgeons.
Okay.
And one of the main symptoms of an STI is urethritis, an inflamed urethra. That's what makes you drip.
Mm-hmm.
Well, there's a thing called the surgical mind. To the surgical mind, you can't have urethritis if you don't have a urethra. Do you get where I'm getting?
Yeah, absolutely. The cure's worse than the disease, I think.
They used to put this, I've seen one.
Okay.
I went to an exhibition in Melbourne back in the 80s. I was like, oh, scared. It's like a urethral sound.
Okay.
You slide it up the urethra.
Mm-hmm.
You then turn a dial on the end and the little blades come out.
Oh, it is. Okay.
And then you get about 6 burly men to sit on top of the patient and you rip it out.
Oh.
So you think you've had bad days?
Well, things have definitely improved.
Things have definitely improved, but it's funny how you still hear there's still kids out there who are scared of the old umbrella. Their grandfathers told them about it. Okay. Even though it hasn't been used for 150 years, the corporate memory of it hasn't gone away.
Yeah.
If someone does that to you, you never forget.
Mm-hmm.
And the story travels fast. Yeah, no, it's a funny old medical discipline. Yeah, probably the first ever research in STIs was done by the military, and for military reasons. But I'm sort of proud. One of the last patients I saw before I left the Sydney Sexual Health Centre was this young kid. I don't know if you know what hit him. He was about 17 or 18, a young gay kid. And he came in, I did a comprehensive sexual health screen, vaccinated him against hepatitis A, hepatitis B, human papillomavirus, and gave him a script for PrEP. And I'm going, the world has changed a lot in the last 30 years.
Yeah, absolutely.
When I first started, we didn't have any of those things. None of the vaccines, none of the treatments.
On PrEP, it's been such a game changer, I guess, for communities now, like in such a change in people's sexual behaviors and.
It was a real game changer. I got one of the guys I work with. He documented that for a lot of gay men, their life has been a misery since HIV came along. Just 30 years of fear, and suddenly, and even I saw that amongst my patients, they were walking in the door with a smile on their face for the first time in 30 years. They were no longer scared of sex, which is a pretty sad place to be. Because there were quite a few people who, at the first mention of AIDS in 1981, literally shut the door and never had sex again, which is not a good place to be.
Yeah, it's not a healthy, positive sexuality. Which everyone deserves. But.
So PrEP's been a game changer like that. And the impressive thing is watching not only the gay community, but also it's helped with the health professions. Eventually they sort of didn't like the idea of putting antiviral drugs out there in the community, but it works so well, and they now understand why you do it. And I was actually reading last week, there's 1 million people in the world at the moment on PrEP.
Wow, okay.
And it's going up rapidly.
So I've asked this question of a few people on the podcast who have mentioned that you've been the most influential person on their career. So who are the 3 people who've been most influential for you?
Professionally, probably 3 people. David Cooper, who was a couple of years older than me, and he was an immunologist at St Vincent's, right in the middle of the target. And he decided professionally, look, I can't run away from this, so if I'm going to do it, I better do it properly. And he was in the bizarre situation where he was learning on the job, where there were very few drugs, or we were desperately trying to access drugs from overseas. And he was setting up clinical trials so that we could have access to drugs pretty well as early as anywhere in the world. And that was 20 years of hard work. And he didn't know what was going on. We didn't know what's going on. They were the funniest talks he used to give, where his most common response was, "I don't know." You told me. He was very good at pooling the experience of all of us who were all floundering in the early days when the drugs were pretty toxic and not as effective as we would have liked. There was a lot of politics where the community people were going, with some justification, were going, "You're poisoning us, this isn't right." So it got pretty tense there, and David was a bit of a rock in a storm there. He was very, so he was influential. Brett Tyndall, just for what he taught me about his community. Dame Julie Bates, for what she taught me about her communities. But probably the most influential people have been my patients.
So you've held a lot of leadership positions both in Australia and internationally. Do you have any reflections on leadership in the HIV and sexual health fields?
Sexual health is a very interesting area, particularly for doctors, and I think nursing too. It's often a second choice. It doesn't occur, because it's not a large specialty, it doesn't have much of a profile in the medical schools, where it's all physicians and surgeons. But it's often people who worked in something else. They've been GPs, or they've been public health physicians, or hospital-based infectious disease physicians, and they drift towards sexual health just because it's a more rounded, holistic specialty than the others. You're not dedicated to just one organ system. You're actually looking after in the whole person, if not the whole community, and that's part of the job.
But public health focus.
Yeah, it's all. And that was something that was invented in Australia. The little training that I did in the UK, they ran very much the internal physician model. In fact, they had just changed their name to genito-urinary medicine when I went there, which was the dumbest thing they could have done. Because within 2 years of them changing their name to genito-urinary medicine, their two major preoccupations were hepatitis and HIV, neither of which have any significant genitourinary complications or implications. So it was just a dumb name. Even the term sexual health came from Australia.
Okay.
Yeah. The first sexual health clinic in the world, or the first clinic to call itself that, was Parramatta.
And what brought that about?
I have no idea. The director was John Moran at the time. He was an ex-military doctor.
Yeah.
Military doctors are another traditionally a source of sexual health physicians. Mm-hmm. Because, even though you join the army so you can fix up wounded soldiers, you actually spend very little time fighting, and most of the time you're sitting around catching STIs. And so the doctors to go, oh, well, change of career, I suppose. I don't know where he got the term from, but it's spreading around the world. Most of my colleagues in the UK now prefer to call themselves sexual health physicians, which that's very much an Australian invention. Even when I changed the name of the Sydney STD clinic to the Sydney Sexual Health Centre, and all the old physicians went, "Oh, that sounds a bit lightweight. It's got the word health in it. Doesn't sound serious." And I'm going, okay, whatever you want. But I was quite pleased to change the name. I didn't really mind the term venereology.
Has a bit of a ring to it. Has a bit of a ring to it. Yeah.
Well, do you know what it means?
No, not really.
It comes from the goddess Venus, the goddess of love.
Yeah,
That's one theory. One of the other meanings, if you get an old dictionary, is venery is actually another name for hunting. I prefer not to use that. I prefer to think of myself as a Lerv doctor. But it's the only medical specialty that's based around a behaviour, not around around an organ. Well, it's one of a wave of medical specialties like addiction medicine and so on, where it's not dedicated to an organ, it's dedicated to a behaviour or a community.
So, thank you very much for being on the podcast today.
Oh, pleasure, Tom.
You've been listening to the Sydney Sexual Health Centre podcast, where I've been chatting with Professor Basil Donovan. To stay up to date with the latest information in sexual health, you can follow us on Facebook, Twitter, and LinkedIn. The links are in the description. And if you like the podcast, don't forget to share and subscribe. Until next time, stay safe and have fun.